directed therapies such as Sotorasib and Adagrasib have limitations. There is both primary resistance that can impact the primary response to this therapy, but there is also acquired resistance, which is the resistance that develops upon disease progression following the initial response to these inhibitors. Now we have at least 3 to 4 studies that are finally trying to dissect the mechanism of resistance to these inhibitors. And we are really seeing highly heterogeneous resistance mechanisms. We are seeing both on-target resistance mechanisms, which are resistance mechanisms that are generally due to secondary KRAS mutation. And this can be either, codon 12 mutation, for instance, a G12V can arise in a G12C cancers treated with KRAS inhibitors. But we're also seeing new KRAS mutations, such as the H95 residue mutations and Y96 mutation that also can confer resistance to these drugs. And what's very important about this is that some mutations, such as the H95 residue mutations, while these may confer resistance to Adagrasib, they may be potentially sensitive to Sotorasib. At least in vitro preclinical modeling of this mutation has shown this. And so this is important because it may suggest that in the future, with tumor genomic profiling performed at the moment of acquired resistance, we may potentially switch between KRAS inhibitors should this data, of course, translate into a clinical meaningful setting. There are also off-target mechanisms of resistance, and these can include the activation of bypass drugs such as MAPK kinase pathway through different sort of signalings. There have been also PI3K mTOR activation as potential mechanisms of resistance, and this can be due to either a mutation in this specific pathway, but also through other mechanisms. And also there's been also KRAS amplification that can contribute to the development of resistance. Not in lung cancers yet, but in other tumor types such as colorectal cancers, oncogenic fusions such as EML4-ALK, which is a common driver in lung cancers, have been identified as mechanism of resistance to KRAS inhibitors. And this is important because we do have targeted therapies for this mutation. And so this again suggests that a tumor profiling at the moment resistance is essential to identify mechanism of resistance and target those mechanisms of resistance whenever possible. And lastly, also from a non-genomic standpoint, histological transformation has also been reported as a resistance mechanism. There's been a case in the New England Journal of Medicine article from Dr. Awad and colleagues, in which there was a case of 2 cases of patients with adenocarcinoma who transitioned to squamous lung cancers. And this is important as well because these cancers may be sensitive to different chemotherapy, traditional cytotoxic chemotherapies. And so this will help us redirecting those patients to the most effective standard chemotherapy as well.